Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today we're talking about hepatitis A, B, and C from the Blue Book. You definitely need to know this for Nclex. So let's go ahead and get started. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, the home of the very best Nclex review in the entire universe. You can sign up for it at clinicreviews.com. And we have a 21 plus hour online on demand Nclex review. You can occasionally catch Mark doing a live in-person review, not all the time, but sometimes he does it. He's close to being fully retired. Sometimes you can catch him doing an in-person review in Ohio. It's the same as the online on-demand review. We also have a streaming service and we have small group tutoring where we do next gen questions. So sign up for that. All right, let's go ahead and get started with our questions. Today we're doing hepatitis A, B, and C. This does come out of the Blue Book. The Blue Book is right back there behind me. You can order it on Amazon. Just type in Blue Book Clinic, and it's the only thing that'll pop up. You can also get it as an app at Clinic Reviews. Download it as an app on your phone if you don't live somewhere that Amazon delivers. So I think you know that I don't teach the content so much as I do questions. This is primarily an Nclex prep channel where I do questions. I teach you how to think. You have to know how to think. My assumption is that you've been through nursing school and that you know the content. And so I do teach as I go through the questions, but primarily we do questions where I teach you how to think like a nurse and clinically reason and prioritize. Which statement by a client recovering from acute hepatitis A indicates effective infection control teaching? I'll avoid any alcohol for 2 weeks. My partner needs the hepatitis A vaccine. I'll share utensils only after I'm symptom free. I can donate blood in 3 months. Okay, so hepatitis A, B, and C. Hepatitis A is spread by the fecal oral route, fecal oral, and then B and C are blood and body fluids. So A is different from B and C, and then A and B have a vaccine and C does not. So there's some similarities and differences between them. A is fecal oral, B and C is blood and body fluids, but A and B have a vaccine or an immunization and C does not have a vaccination. All right, so if we know hepatitis A is spread by fecal oral, and it can affect, so hepatitis can affect the liver, right? So when someone's, and hepatitis A, this is also unique about hepatitis A is it's not chronic, it's an acute infection. And so they experience the infection and it feels a lot like having the flu, except so they'll have fatigue, they'll have nausea, anorexia. The other thing though, is it does affect their liver. So they may have some right upper quadrant pain. They may have some jaundice if the bilirubin levels increase, serum bilirubin levels increase. The stool may turn pale because the bilirubin's not going out in their stool, it's hanging out in their body. The urine might turn dark. These are all symptoms of liver involvement with the hepatitis, okay? All right, so those are things we know about hepatitis and liver involvement. So I'll avoid any alcohol for 2 weeks. We're looking for indicates effective infection control teaching. I'll avoid any alcohol for 2 weeks. Well, they want to do that, but they want to avoid alcohol for a lot longer than that. So that's not really effective. I would say avoid alcohol for 6 months. My partner needs the hepatitis A vaccine. That would be a good idea, actually. Their partner should have a hepatitis A vaccine because there is a vaccine for it. I'll share utensils only after I'm symptom free. I would say don't share utensils for at least 3 months, probably closer to 6 months. I can donate blood in 3 months. No, you cannot. I would want to test them and know that they're negative before they go thinking about donating blood. So the only one that shows effective teaching is my partner can get the hepatitis A vaccine. So that's the best one there. While reviewing labs, which finding supports a diagnosis of chronic hepatitis B? Positive anti-hepatitis A virus, immunoglobulin M, positive hepatitis A something, probably antigen, maybe, anti-hepatitis C virus antibodies, positive hepatitis B something S antigen. All right, well, this is hepatitis B. So A is hepatitis A, B is hepatitis A, and C is hepatitis C. So D is the only hepatitis B, and it's positive. It'd be a positive antigen, which would tell me that they have got hepatitis B. So that's the only one that makes any sense. So even if you don't know what all the words mean for these abbreviations, just know that HAV, HBV, HCV means hepatitis A virus, hepatitis B virus, hepatitis C virus. So that's something you should definitely know. A nurse in the ED receives 4 clients with suspected viral hepatitis. Doesn't tell us what kind, because if they're having an acute exacerbation of B or C, or if they have an acute infection of A, they're actually going to have similar symptoms. They're all going to be fatigue, nausea, anorexia. They may have some elevated liver enzymes. They may be somewhat jaundiced. They may have some itching, pruritus, those kind of things. Those are all show that there's some liver involvement, which usually occurs with an exacerbation of any type of hepatitis. Okay, 4 clients. Which of the clients should the nurse assess first? 19-year-old with dark urine and right upper quadrant pain, 34-year-old with scleral icterus and pruritus, 46-year-old with new confusion and asterixis, 28-year-old anorexia and low-grade fever. So they all have suspected hepatitis. So what we always are worried about the unstable patient, and an unstable patient can have unexpected findings. They can have sudden change in assessment. Those are probably the 2 that I would look for. None of them had a sudden change in assessment. So, well, we do have new confusion. So that's a problem. New confusion. So that's a sudden change in assessment. And I'm also looking for unexpected findings. So dark urine and right upper quadrant pain. Right upper quadrant is the liver. Dark urine is they're losing bilirubin in the urine, not in their stool. So that's actually expected if they have viral hepatitis. Scleral icterus, that's just yellowing of the sclera. And pruritus, that's itching. Those are symptoms of an acute hepatitis. New confusion and asterixis. Asterixis is flapping of the hands, which happens with hepatic encephalopathy. So new confusion and asterixis those are symptoms of hepatic encephalopathy, which is a complication of liver involvement. They're not symptoms of liver involvement, they're complications. It means the ammonia is building up in the body too much, and that's a big problem. It's called hepatic encephalopathy. 28-year-old with anorexia, which is no appetite and low-grade fever. Again, it's a viral infection. You can expect to have a low-grade fever. So A, B, and D are all expected. So C is my unexpected patient, also has new onset confusion. And so this is the person I'm going to see first. Which dietary choice is best for fatigue and nausea during acute hepatitis C? So B and C, although they're both chronic diseases, can have acute exacerbation. So that's what they mean by acute hepatitis C. So let's just think about this. If they have problems with their liver, we probably don't want to do high protein, because high protein can exacerbate encephalopathy. But we don't want to go low protein because they need to have enough energy to heal. So we usually say moderate protein. Carbs are fine, no problem with carbs, but we don't want to have like high fat. Nobody wants to have high fat anything. So I would say low to moderate fat, moderate protein, low to moderate fat, probably high carbs. And we have nausea. So we want to think about foods that are easier on the stomach. So we want to find foods that are not too high in protein, not too high in fat, good carbs, but easy on the stomach. So that's what I'm looking for. Beef burger with cheese, fried chicken and coleslaw, creamy mushroom soup and crackers, toast with peanut butter and banana slices. All right, beef burger with cheese. That seems like we've got a lot of fat and a lot of protein. And I really don't want high protein with an acute exacerbation of hepatitis. Fried chicken, that's high fat. I'm not going with anything fried. Like, I don't ever pick fried anything on Nclex. Creamy mushroom soup and crackers. That might be okay. I don't know about creamy soup. I don't know how that would go down if you're nauseated, but it's better than A or B. Toast with peanut butter and banana slices. Now that sounds like something my mom would have made for me when I was feeling sick. My mom was a nurse, by the way. So we've got carbs with the toast. We've got some protein and fat with the peanut butter. We've got carbs with the banana. So this is actually a good, well-rounded meal without being too high in fat or too high in protein. but it still would be easy on the stomach. So look, I don't like nutrition questions or dietary questions. I get them wrong every time. I don't get them wrong every time. I have to think through what the question is really asking me. So I can't just look at it and go, oh, that looks good. Like, I have to actually problem solve through it, clinically reason through what it's asking, because there's no memorized answer for these, particularly nutrition questions. I mean, unless they're asking about vitamin K. Vitamin K is in green leafy vegetables and organ meats. Like, that's something you can memorize. But most nutrition questions are not about what did you memorize? They're about what is this best for this person and what should you be thinking about? What do they need as far as calories and so forth? And then the nausea on top of that. So just, you need to you need to be intentional about using clinical reasoning and common sense while you're taking the Nclex. The nurse is planning a health fair booth on hepatitis A prevention, which is fecal oral route. Which strategies should be included? Encourage thorough hand washing after diaper changes. Provide single dose immune globulin to all adults greater than 60 years old. Emphasize proper cooking of shellfish. Recommend vaccine for men who have sex with men. Promote needle exchange programs. Stress covering mouth when coughing. So fecal oral. So don't make the mistake of saying, well, I don't think a baby's going to have hepatitis A. That's not what you say. Okay, you don't say that. You say anything that shows that it could be fecal oral, I need to choose it. And hand washing after diaper changes is the best example of fecal oral route, right? So you've got to wash your hands after changing diapers. Provide single dose immune globulin to all adults. That's not the vaccine. So that's not something, no. Emphasize proper cooking of shellfish. So oral, shellfish, I don't know if shellfish carry hepatitis, but I know that eating undercooked foods is a way that various diseases are spread. And so I'm just going to use common sense and clinical reasoning. And I didn't memorize it, but it just makes sense to me that proper cooking of foods like meats and shellfish and things would be important. So I'm going to choose C. Recommend vaccine for men who have sex with men. That seems good because it's fecal oral. Yeah, that just makes sense to me. Promote needle exchange. It's not blood and body fluids, so I'm not picking that. Stress covering mouth when coughing. It's not it's not spread by coughing. Like, that's not how it's spread. Okay. So these are the strategies in preventing the spread of hepatitis A. Which occupational group has the highest incidence of percutaneous HBV, hepatitis B virus exposure? So all that means is who's most likely to be exposed to Hep B. It's blood and body fluids. Elementary teachers, housekeepers, dental hygienists, restaurant servers. So I would think elementary teachers, housekeepers, and restaurant servers would be more A, whereas dental hygienists are going to be more likely to be exposed to blood and body fluids. So I'm going to go with C, dental hygienists. A nurse reviews new orders for a client with severe acute hepatitis B and an INR of 2. Which interventions require clarification? So when you have, severe hepatitis of any kind, and you have significant liver involvement, it affects bleeding time. So if the INR is elevated, okay, because an INR of 2 is slightly elevated. If the INR is elevated, it means their liver's pretty involved. And so they are at risk for bleeding. And so you say, all right, they have liver involvement, they have Hep B, and they are bleeding risk. So which interventions require clarification? Vitamin K, 10 milligrams. I like that order. They're bleeding risk. We can give vitamin K, which promotes the production of vitamin K-dependent clotting factors, which will decrease their bleeding risk. Acetaminophen, okay, I don't like that. You can't take Tylenol, acetaminophen when you have liver problems. So that should be questioned. Lactulose. Well, lactulose is given to reduce ammonia production, and ammonia is produced by E. coli in the body, and it's then taken to the liver to be broken down. And when the liver is not working properly, the ammonia tends to build up. So if you give lactulose, you can get rid of ammonia through the stool. So I like that order. Low protein diet I don't want to do low protein. I do moderate protein. The only time I do low protein, maybe do low protein, well, I would do low protein, is if they actually give me a diagnosis of hepatic encephalopathy. If they give me that diagnosis, I'll say low protein. But this person needs to have enough protein that they can heal, because what's happening is it's an albumin thing. And without getting into all the problems of cirrhosis of the liver, albumin third spaces and it pulls fluid out. And so you end up with ascites and peripheral edema and so forth. So you've got to have enough protein that you can try to replace some of that albumin. So I don't like low protein diet. Neomycin also goes through the GI tract and kills E. coli. And E. coli are the number one producer of ammonia. And you people with severe hepatitis / cirrhosis tend to aggregate ammonia. And so neomycin is a good order. And entecavir. I don't know how you say that. So I know anything that ends in VIR is an antiviral. I don't know if this is the proper drug, but I know hepatitis is a virus. And so to give them an antiviral makes sense to me. So I like A, I like C, I like E, and I like F. Which interventions require clarification? So the what requires clarification is B and D. Now, that requires a lot of knowledge related to the liver. So that's something to think about. Do you remember liver content? If you want me to do a liver video, let me know. I don't think I've done a liver video. I don't think I've done cirrhosis. But if you want me to do one, let me know. It would be more of a lecture style video than question. I mean, I do some questions, but be more lecture because it's a lot. There's a lot going on there. Which nursing actions reduce transmission of hepatitis C in a hemodialysis unit? So hepatitis C is spread by blood and body fluids, and hemodialysis is possible exposure by patients and nurses to blood and body fluids. So what reduces transmission? Dedicated dialyzers for hepatitis V positive clients. Wear double gloves for all vascular access. Place HCV positive clients in airborne isolation. Perform meticulous environmental disinfection between treatments. Assign HCV positive clients to the same nurse each shift. Dispose of sharps immediately in puncture-resistant containers. So we have to use our common sense and clinical reasoning here because I didn't memorize this. This is not a list I memorized. In fact, SATA questions almost never are a list you memorized. It almost always requires clinical reasoning. So does it make sense that using dedicated dialyzers for HCV positive patients, does that make sense? Yes, it does. Honestly, if I were going for dialysis, I wouldn't want to use the same machine that somebody with positive hepatitis used. Like, I just would not be thrilled about that. So that makes sense. Wear double gloves for all vascular access. Okay, double gloves doesn't help. Double gloves does not help because if you stick yourself with a needle, it goes through double gloves the same as it goes through one glove. So B does not help. Place HCV positive clients in airborne isolation. It's not transmitted via air currents. It's blood and body fluids. Perform meticulous environmental disinfection. That makes absolute sense. I'm definitely doing D. Assign HCV positive patients to the same nurse. So only one nurse gets exposed. I don't think that's going to reduce transmission. Dispose of sharps immediately. Absolutely. Absolutely. So these are the ones that make the most sense. This is not something you should have memorized. You should just be using, y'all, especially on SATA questions, do not forget to use clinical reasoning and common sense. Common sense. You do have to understand basic disease processes. You have to understand basic prevention. You have to understand transmission. You have to understand that hepatitis is but hepatitis B and C are blood and body fluids. But the rest of the way you answer this is just common sense. The nurse prepares discharge teaching for a client with compensated cirrhosis from chronic HCV. Which vaccine should be prioritized today? Influenza, zoster, hepatitis A, or varicella? So I don't know what they're allowed to get. I would have to look it up to know what they're allowed to get. But I do know that there's a vaccine for Hep A, and that if they get Hep A on top of their Hep C, that's not going to be good. So I'm choosing Hep A. And that was pure common sense right there. That was pure clinical reasoning and common sense. I didn't have that memorized. It was just looking at it and going, what makes the most sense for this patient? A client treated for acute Hep A is ready for discharge. Which follow-up lab timing is appropriate to ensure recovery? All right, so Hep A is fecal oral. I know it can affect the liver. A lot of their symptoms are liver related, but it's an acute infection. It lasts between 4 to 6 weeks. They're not always hospitalized, but this patient is being discharged. So what will follow-up lab time is appropriate to ensure recovery? In other words, we diagnosed it right and you're actually getting better. ALT and AST in 6 to 8 weeks, ALT in 24 hours, anti-HAV IgM in 48 hours, HBsAg in 3 months. So D doesn't make any sense. I don't know what C would tell me. I don't even know what that would tell me. So anti-HA virus immunoglobulin. I don't know what that would tell me if they've already been diagnosed with hepatitis A. ALT in 24 hours. Well, they really don't start to get better for 4 to 6 weeks. So it doesn't seem like an ALT in 24 hours would tell me much. Whereas an ALT, AST, which are liver enzymes, in 6 to 8 weeks would tell me their liver's recovering, they don't have any problems, no complications, they're getting better. So that's the one that makes the most sense to me. Which clients need immediate Hep B post-exposure prophylaxis with HBIG, which is hepatitis B immunoglobulin, and the vaccine series, which is 3 shots. So hepatitis B doesn't say they have it, but it looks like when someone's exposed to hepatitis B, they recommend an hepatitis B immunoglobulin, which I think acts to immediately fight it off. And then the vaccine prevents future exposure. So I think that's what they're saying. So in other words, who's exposed to Hep B that would benefit from this? Infant born to HBsAg positive mother, unvaccinated nurse with needle stick from HBsAg, positive client, partially vaccinated toddler who bites a classmate, fully vaccinated dialysis client whose machine malfunctions, sex partner of person newly diagnosed with HPV, healthcare worker exposed to HPV positive saliva touching intact skin. All right. Well, it seems like the infant born to the positive mother would definitely benefit from that because, they could definitely they were definitely exposed to it. I don't know if they've got it, but they were definitely exposed to it. Unvaccinated nurse with a needle stick from a positive client, that would definitely recommend that. Yes. Partially vaccinated toddler who bites a classmate. I mean, partially vaccinated. No, I mean, they're in the middle of the series. They should be fine. And I mean, unless they tell me the classmate has HBV, then that doesn't seem like a big risk. Fully vaccinated dialysis client. No, if they're fully vaccinated, they don't need to be done it again. Sex partner, somebody newly diagnosed. Yes. Healthcare worker exposed to positive saliva touching intact skin. Very low risk there. Very low risk. Intact skin protects us. It doesn't go through the skin. Saliva generally has very low amounts of the virus in it, and the skin isn't protecting you. So these are the 3 people that I would recommend prophylaxis with HBIG and vaccine series. The nurse monitors labs in chronic HCV, hepatitis C vaccine or virus, hepatitis C virus, elevations of which tests most strongly suggest progressing fibrosis. So that means fibrosis of the liver. So basically what lab tests tell you the liver's not working right? Elevated hemoglobin, elevated AST-ALT ratio, low potassium, low platelets, elevated INR, or low albumin. So again, I haven't done a lecture, I don't think, on cirrhosis, but with cirrhosis, you're looking for elevated liver enzymes, in particular the AST-ALT ratio will be elevated, so that one is for sure. There's no reason to think hemoglobin would be up or potassium would be down. Those aren't specific to the liver, so those aren't going to tell me anything specific to the liver. Platelets, thrombocytopenia is a symptom of cirrhosis, particularly progressive cirrhosis. So platelets under 150 is low, 150 to 400 is normal. And so that's why people with progressed cirrhosis are at such high risk for hemorrhage, because their vitamin K dependent clotting factors are low because they're low vitamin K and because their platelets are low. So that's definitely one. Iron are elevated. That means they're higher bleeding risk. Definitely. Albumin is low. That's definitely a problem with cirrhosis because the liver is involved in making albumin. And so the albumin is going to be low. So those are the things that would suggest that it's progressing to actual fibrosis of the liver, chronic HCV. The nurse evaluates understanding of home care after hepatitis A. Which client actions require intervention? Rest periods between light activities, taking prescribed hydroxyzine for itching, preparing meals for family 1 week after jaundice onset, avoiding alcohol for 6 months, using own towels and washcloths, returning to work as preschool teacher 2 weeks after symptom onset and feeling better. Okay, home care for hepatitis A. Which client actions require intervention? So these are bad things. We don't want them to do these things. Rest periods between light activities. That's good. Remember, they feel a lot like they have the flu. And it can last 4 to 6 weeks. So, I mean, it may only last 2 weeks, but it could last up to 4 to 6 weeks. So you need to have rest periods between light activities. Taking prescribed hydroxyzine for itching, that's appropriate. If they're, remember, pruritus, which is itching, is a symptom of cirrhosis. Preparing meals for family 1 week after jaundice onset, no, that doesn't seem like a good idea. Avoiding alcohol for 6 months, yes, that seems like a good idea. Using own towels and washcloths, yes, that seems like a good idea. Hepatitis A is oral fecal. Returning to work as a preschool teacher 2 weeks after symptom onset and feeling better, no. They're probably going to be off work for at least 6 weeks. So it's going to take that long till they're really feeling better. Okay, so let me know if you want me to do a cirrhosis video, and I hope that was helpful to you. Hepatitis A, B, and C are only complicated in that they affect the liver, and so you do have to know something about the liver in order to get some of the Hep A, B, and C questions correct. So good luck on your Nclex. We are wishing you all the best here at Clinic Reviews. We love you, and see you later.